Well, here we go with our first speaker. And thank you so much for being here and bringing your expertise.
Yeah, I think I'd be more comfortable. Being so nervous. Okay, here goes the timer. It's hard to think about what's useful to an audience like this where you have all had this amazing consciousness and vision of what it would mean if labor fought for a social movement in this country, and what it would mean for the entire democracy, what it would mean for everybody. I think I should introduce myself a little bit in this way. In 2012, I had a very difficult year professionally because I was working for the state taking care of patients with serious mental illness. And although I was learning a great deal about the terrible side effects of antipsychotic medications, for example, and learning a lot of neurology and able to help some people in some limited way, the state coming down on these patients, bragging about things like $4 per day, getting under $4 per day for their food, about warehousing them, about subcontracting out transportation so the people that lived in the residences could no longer get to their medical appointments. Progressively, I could no longer provide care that was even close to excellent for my patients. It became enormously frustrating. Meanwhile, I helped organize a dissident caucus with Jerry Tucker as my mentor in the Public Employees Federation. And my colleagues in the leadership wanted me to run for president of PEP at the time when I felt that I wasn't being effective as a physician. I needed to be able to get back to my skills. So I felt that Sue Kent would make a better president than me anyway. And Sue Kent is now the president of the 54,000-member Public Employees Federation. And we're enormously proud of her, and we have a great ally in the PEF leadership now. So I went back to the community hospital where I could do critical care, I could do the care of the acutely ill, and I could reconquer skills that I felt that I was losing. And every day, we admit people for poverty. Every day, we have patients who cannot get what they need because of some stupid managed Medicare rule, because they don't have insurance, because their insurance denied something, because there's a copay that they wouldn't pay, they delay coming to the emergency room. We see the consequences every day in our patients. And I think more and more, it's our obligation as physicians to explain those consequences. So in general, what's happened? In general, we had a so-called health reform, the so-called healthcare overhaul, the Heritage Foundation's idea, written by the healthcare insurance industry itself, promoted by the Democratic Party president. And now it has touched off an acceleration of profit-seeking that is breathtaking and impacting us already. The so-called accountable care organizations, the rush to draw a fence around patients and reconstruct health maintenance organizations as a systematic way to deny patients what they need. And their money will be extracted in little bits to all kinds of subcontractors all along the way. In our hospital, you can see the subcontracting as an example. The printer wasn't working on the 6th floor, and they said, oh, well, there's the computer guy. And he said, no, I don't fix those printers, I only fix the prescription printers. There are 2 companies that fix 2 different printers. And if everybody's taking out their little piece, all of that money is not going to the patients. At the same time, the rich are getting spectacularly rich, and the poor are getting unbelievably poor. And so where in our country, at one point, healthcare could somewhat ameliorate some of the most hideous social injustices, right now healthcare is in a terrible position of making them worse by the co-pays and all of the impediments, the incursion of high deductible plans that people can't even afford. So we're in this situation where we have got to have a higher social consciousness about what it would mean. I just make a comment about PNHP. PNHP is entering its 26th year. I've been a pretty vigorous activist for about a decade in PNHP. PNHP brings to this struggle something that's very special. Last night, Karen Lewis said that we have a moral obligation. We have a moral obligation to provide care for everyone, for children. And that's absolutely true. Healthcare should be a human right, and we all passionately believe that, and that's absolutely true. And we have friends in the faith community who explain their profound religious motivations for why healthcare should be part of the good society that everybody wants. PNHP brings to the social struggle social science about what makes people healthier. And by staying within that social science, we make a unique contribution to the struggle for social justice, an essential contribution to the struggles for social justice, because it becomes an irrefutable fact. We can explain how it is that the resources are sucked away from our patients by unnecessary tests, unnecessary treatments, ridiculous administrative overhead, all kinds of profiteering. How all of those resources could go to patients and tell you exactly what it would mean. And so when we have this situation that we're in now, where we have spectacular resources to squander in the United States healthcare system, we have these unbelievably well-trained and dedicated nurses who would do anything for their patients. We have fantastic medical schools. We have the capacity for great science. We have whiz-bang technology everywhere, and yet we literally squander the resources. And we can talk about, in terms of social science, how those resources could be spent. So in the minute and a half, about the vision for labor. The idea that Jerry said, that Mark quoted, that labor wins when we build a social movement. We have to take that to labor. We have to confidently, with conviction, keep to the courage of our convictions, because the contradiction is that there's a crisis right now, and we could have national health insurance right now, and as long as that contradiction exists, we can drive into it. As Jerry said, we need to tell the proverbial truth to power, but also to each other. We can do this. That's the truth. That's the objective social conditions we face. So, I'm going to close with Frederick Douglass. Let me give you a word about the philosophy of reform. The whole history of the progress of human liberty shows that all concessions yet made to her august claims have been born of earnest struggle. The conflict has been exciting, agitating, all-absorbing, and for the time being, putting all other tumults to silence. It must do this, or it does nothing. If there is no struggle, there is no progress. Those who profess to favor freedom and yet deprecate agitation are men who want crops without plowing the ground. They want rain without thunder and lightning. They want the ocean without the awful roar of its many waters. This struggle may be a moral one, as Karen Lewis reminded us, or it may be a physical one, and it may be both moral and physical, but it must be a struggle. Power concedes nothing without a demand. It never did, and it never will. And I would point out that H.R. 676 is not just a piece of legislation in the Congress. It is the best organizing tool that we have had to teach people what this demand means. So many of our best activists have learned about single payer by reading that bill, and I think we should use it as an organizing tool.